Welcome to another episode of Synergy Speaks. I'm Bushra. Today I'd like to talk to you more in depth about such a crucial step when you're submitting your full arch Synergy case, which is proper records. Most of the issues or delays we encounter are due to poor or missing records. So let's go through and cover a checklist for everything that's needed and what to look out for when you're submitting your full arch Synergy case with us. So first is the cone beam CT scans. What we need is a full anatomy of the upper and lower, including zygomas and condyles. Second, the teeth need to be in separation, out of occlusion, when taking the CT scan, using either cotton rolls or a gauze. Third, make sure the patient stays still while taking the CT scan. Before exporting the DICOM, it's very important, and before dismissing the patient, to have a look at the CT scan to make sure there's no movement. Look out for any double image in the CT scan or breakage points. That's very indicative of movements in the CT scan. Edentulous patients, you'll need a dual scan. What that is you need to take a scan of the patient wearing the denture in occlusion with radiopaque markers, and then a scan of the denture by itself with the markers on it, resting on a foam or a chin rest. The denture must fit perfectly to the tissue. If not, scan after relining using either hard reline or blue mousse or any PVS impression material. Soft reline is usually not recommended. Patients with a lot of crown and bridge work, we recommend sending you a scan appliance with markers on it to help with the scatter created while scanning the patient. Second, let's talk about models, either intraoral scans or physical impression models. Maxilla and mandible, please capture the upper and lower anatomy, especially the full palate and vestibules and the retromoral pad areas. If you feel that custom trays are needed, please request one to capture the anatomy that we just mentioned. Patients with partial, we need two impressions, one with the partial and one without the partial. Let's talk about edentulous cases. We're gonna do the same dual scan protocol that we mentioned earlier. For single edentulous cases, just make sure you send an impression of the opposing arch. Third, bites, whether it's intraoral or physical bites. If the patient is missing posterior stops, please allow us to fabricate occlusal rims. These occlusal rims can be used to mark necessary information, just as the midline and the lip position. If the bite needs to be opened significantly, we recommend a try-in for the patient to try in the new bite for a short period of time and make changes if needed, then send that back. It's up to the clinician to take either a CO or a CR bite. MIP is commonly used on most of our cases. Please include any special instructions or changes needed for designing the wax up, like midline, BDO changes, plane of occlusions, shape of the teeth, shade of the teeth, any changes you needed in the wax up before submitting your full arch case. Fourth, photos. We need full face smile photos. Make sure to include the eyes and ears. The camera must be level to the patient's face. Patient needs to be at a 12 o'clock position, not tilted too forward or backward. We need smile photos. We need a smile at rest, an exaggerated smile photo. This is how we determine how much restorative clearance needs to be created to hide the transition line between the prosthetic and the natural gingiva. Full face retracted photos. This is to determine the occlusal plane. We need left and right photos in occlusion. This is how we visually confirm the bite. So if you want to go over this checklist when you're submitting your next full arch Synergy case, you can find this by going to our website, navigation.net. Well, I hope you enjoyed this episode of Synergy Speaks. Please don't hesitate to reach out to our navigation team if you have any further questions at 1-844-NAVIGAT. And remember, it's not just a surgery, it's a smile synergy.